Hello. Here we are live in the middle of the day. We're gonna be going on with Rachel Tuckman. So, hey Rachel. Let me join. There we go. Okay. We'll wait for her. But in the meantime, for whoever's able to come and watch it live, great, amazing. Hey Rachel.
How are you?
Good. How are you?
Good.
Yeah, so I was just saying, whoever's able to watch it live, amazing. And anybody who can't make it for 12 o'clock, you'll watch it later. We'll save it, like we always do. So it'll be saved for 24 hours and it will be on our YouTube. Yeah. So anyway, for those of you who are on, I don't know if you've seen Rachel's lives before, but she's joined us a couple times in the past, and they have been amazing. So let's just do another quick background, and then we'll get started into our topic.
Okay. So I'm Rachel Tuckman, licensed mental health counselor. You can follow me on my page, Rachel Tuckman LMHC. I work in the 5 towns. I have a private practice. I work with kids and adults, women with infertility, post-hysterectomy, and I don't know, I'm here today. We're talking about a family member being diagnosed with mental illness. And some of the questions that we had that were in that promotional ad or whatever it is that we were sharing was, we wanted to know, what is your role when a family member is diagnosed? How can you be supportive? What can we do as a community, right? To make sure that even though we don't know what's happening, people who have mental illness in their family feel like they're not alone, and they'll reach out to those resources that are available. What do we do if they're in denial, and what if they refuse help? So those are the things that we're going to touch on today, right?
Yeah, it's a good list. Yeah, so do you want to just jump into?
Sure. Yeah. So in one of our lives, I think it was like our first live together, we had talked about mental illness.
Our first live ever.
Yeah. So we talked about mental illness and mental health, and we talked about how everybody has mental health. Not everybody has mental illness, right? And we said that mental health is just like your physical health. We all have physical health, and mental illness is kind of like the equivalent of like getting a cold or getting the flu, So it's this disorder that affects your mood, your functioning, your thoughts, your behavior. There is a biological component to it. It's treatable though. Just like when you have a cold or the flu, it's treatable. And just like even if you have a chronic physical condition, it's treatable, and you can learn to live with it, and you can make it, the effects of it, you can kind of like draw out you can live longer and you can live better even with that physical illness. Same thing here. You can have a mental illness that is treatable. You can live better than someone who does not have a mental illness. So I think that that's something we all need to understand, that you can live a rewarding life with a mental illness if you're getting treatment, and if you're in the right treatment, and if you have supportive family. And I'm going to talk a lot about that supportive family element. But I think that if we understand that will help take away some of the stigma of mental illness. So if you find out that someone in your family has a diagnosis of mental illness, it could be a spouse, a child, a family member, a sibling, it can be a shock, right? It's shocking, especially if there's no history of mental illness in your family, or even if there is, but it's someone who I don't think we ever think someone's going to be touched by mental illness, right? Not me, not my sister, not my brother. So it's really shocking. But I think sometimes it can also be a source of relief sometimes for a family, because if you've seen a lot of behavior that's been scary or confusing for you, sometimes when there's like a name kind of attached to it, then you're like, okay, now we can get a treatment plan. Now we can, begin recovery. Now we can figure out how to get them the help they need. So sometimes that shock is very strong, but then if you kind of, with time, and I'm going to talk a little bit more about that, but with time, you kind of learn like, okay, now I know what it is. I can start researching it. I can start understanding it, and I can start getting them the help they need. So that's really my going to be one of my first points. But I just want to, before I even get to that, just say like, what are some things that you might be looking for if you think maybe someone in your family has mental illness? Like, what might you start noticing? So some of the signs might be like social withdrawal, right? So they used to be like super friendly.
Can I just point out how good of a question that is? Because if, just like from my experience and from seeing other people in other families, if you're able to catch it and know what to look for, before it gets too late, it makes like the world of a difference in what happens with the treatment process.
Yes.
So like that's just such an important question. Anyway.
Yes. Definitely makes it easier, because if you catch it early on, you're less likely to deal with a lot of the resistance that you might deal with when they're really like stuck in that illness, right? So yeah, so social withdrawal. So if they're normally someone that's pretty social, you know, hangs out with their friends, even that they're pretty family oriented, but suddenly they start pulling back, you might start, you know, you're going to notice that combined with a bunch of other things, you're going to notice that. If they have difficulty functioning at school, at work, at home, normally they're like a very together person and like they're kind of falling apart. They are having problems with their memory or thinking. They seem all over the place. They can't like get their act together. And normally like they're pretty together and, you know, with it, even if they're more uptight, like they kind of like function in their daily lives. Any changes in their sleep, their eating, their hygiene, drug or alcohol abuse, obviously, right? Extreme mood changes, right? So they're very irritable, or they're hypersensitive, or there's major anxiety, whereas like before they were maybe a little anxious, but now it's like constant, and you start getting worried, like, why are you so anxious all the time? And obviously thoughts of suicide, those are the, you know, suicide, drug and alcohol abuse, that's kind of like the more obvious stuff, but sometimes we miss the littler things like not being so social, or kind of like not being so organized. So looking at that, if you do see these things and you get concerned, stay calm. Do not freak out. Sometimes these signs of mental illness overlap with other problems. So it could be that maybe they lost their job, or their boyfriend broke up with them, or maybe they started like school, they started college and they're stressed out from college, or they're taking, you know, the LSATs and they're freaking out. So you have to kind of look at what are their life circumstances, like what's going on, that maybe that's really what's happening, instead of like diagnosing them and being like, okay, we need to go to a psych ward, right? Maybe life is just happening. So look at that. Either way, even if it is just life, you can encourage them to get help. You can say like, you seem stressed, like, is everything okay? I know you're studying for those, you know, boards or whatever it is. Like, do you want to go out? Can I like, you know, take you for a coffee? Do you want me to take the kids for you one day? Whatever it is, you offer to help, and you can encourage them to get help. So how do you encourage them to get help? That's the tricky part, because it's a sensitive subject. But the first thing I would say is like, use gentle language. Don't be like, what's wrong with you? You're acting crazy, you know? Just gentle language. Like, you don't seem like yourself lately. I've noticed that you seem pretty stressed out. What can I do? Do you feel like you want to talk to me? Back up the statements with facts also. So if you're going to say like, you seem stressed out, say how they seem stressed out, right? Because they might be like, no, I'm not. Like, leave me alone. But you should say like, no, you do. Like, I've noticed that, you know, when I ask you to go out, like you seem overwhelmed, or like your laundry pile is like to the sky and normally you're on top of that. Like, are you sure you're okay? Do you need some help? Right? So backing it up with facts. Don't blame them either, right? So you don't want to use like alarmist language, like, I think that you need to see a therapist, or I think there's something wrong with you, or maybe there's something like, maybe you need medication. Don't say those things. Just come from a place of love and concern, non-judgmental. Encourage them to talk to a healthcare provider. So you don't have to say, go see a therapist. You could say like, maybe you should just talk to your doctor. Maybe they should run some blood work. Maybe just like go and see if maybe they have some suggestions for you, because sometimes that's less scary for them to go to their GP, which again, I want to take that stigma away. People are more willing to talk to their doctor, even their dentist, or their hairstylist, than they're a therapist. So you could just say, maybe just like talk to your doctor and see what's up. And sometimes the doctor will say like, okay, you know, I'm going to refer you to a therapist or a psychiatrist. So sometimes that opens the door. And you know, again, saying like, maybe you should talk to a therapist, you got to be careful. Like, that can be scary, and that'll make the person close up and not want to listen to your advice. Offer to go with, right? So if, let's say they're open to going to the doctor, you could say like, I'll come with you. And, you know, if you want me to help, like talk to the doctor and tell them what I see, I'm glad to do it. Or you do want to go to therapy, I'll come to that first appointment with you. I'll sit in the waiting room. I'll drive you there, whatever you want. If you think it's an emergency, like if it's really bad, obviously you call 911. If you think they're going to hurt themselves or they're just in a bad place, you don't like, oh, maybe we should go to the doctor. Like, you should get them help if you really feel that they're going to hurt themselves. Some of the emotions that you might feel are normal would be guilt, shame, disbelief, fear, anger, grief, right? There's a lot of grief when we find out that someone is diagnosed with mental illness. Sometimes people feel like they lost the person that they knew, which I want to talk about a little bit more and just say, like, it's the same person. You know, just like if I have the flu and I'm acting all kinds of like irritable and moody and tired, I'm still Rachel. So even if your family member has mental illness, they're still whoever they are. You know, it's just their mental illness doesn't define who they are. We just have to get it under control so we can bring them back to who they are. And that's something to remember. Sometimes families say, I lost them. When we find out they were, you know, diagnosed with depression or anxiety or schizophrenia, we lost them. No, you didn't. They're still that person, but now they have this mental illness that they have to grapple with and manage. So we have to remember that they're not a lost person. They're the same person they always were. They just have this illness now that they have to make sure that they take care of. Acceptance takes time. So it's going to take time for you to accept that it's still the same person, especially if they are acting in ways that are not recognizable. It's going to take time for you to accept, like, okay, this is still the person I know and love, and they're going to be okay. It takes time for the person who is diagnosed to accept it. Sometimes there's a lot of denial and shame and disbelief. How did this happen to me? I can't believe this. Like, when did this happen? How did I miss the signs? So you have to remember, like, they're also working to accept. And it happens at different paces for everyone. Everyone's going to come around at their own time. And your job is just to focus on you finding acceptance, you finding peace. Don't worry about how everyone else, you know, you should be nicer to your brother. He's dealing with something. Let them be. When they're ready to be nicer to the brother and kinder and more understanding, they will be. You just have to be the consistent, kind base, and don't worry about other people's journeys. Really important to educate yourself about whatever it is that this person, that's family member, is going through, so that you know what to expect and you can give the right kind of support. So Google it, but like make sure it's reputable sources. So make sure it's the National Alliance on Mental Illness or the APA. Like, don't just, like, you know, look at Wikipedia. Like, I want you to find reliable sources for mental illness information, and make sure that you know the symptoms so that you can know when the illness is not being well controlled. So you know, you can kind of detect, like, if they're off their medication or if they're not doing what they're supposed to be doing. You want to be, like, aware so that you can be helpful. So again, trusted sources are really important. Talk to a therapist, talk to a psychiatrist yourself. That's going to be important anyway, that you should be getting support, because self-care is super important when you're dealing with family members who have mental illness. Sometimes we get so obsessed with, like, taking care of them, we forget about ourselves. We also forget our families. Like, if we're in a marriage and we have kids or we have other things, sometimes we neglect ourselves to take care of the person with the mental illness. And that's really not a good thing, because you cannot pour from an empty cup. You can't give support and love and concern if you're not giving any of that to yourself. You're going to burn out, and it's going to be bad for everyone involved. So taking care of yourself. I want to talk a little bit about the idea of balance support, right? So you want to be supportive of your family member, but you also need to be supportive of yourself. So medication can be effective for controlling symptoms of mental illness. Remember that it might take time for it to be effective. So if you go with your sibling or whoever it is, or your spouse or your cousin or your whatever, to the psychiatrist, and they give them a medication, don't expect that the next day they should be fine. It takes time. They have to play sometimes with dosage. They have to see what works and what doesn't. It takes time. They usually say 2 to 6 weeks, sometimes longer, 3 months. Give it time. But of course, you stay in touch, or they stay in touch with their psychiatrist to make sure that they're reporting how they're feeling, if they feel the effects, whatever it is. But remember that it takes time, and you have to be patient. And freaking out, like, why isn't it working yet? That's not helpful, right? You may want to take charge, right? You're going to want to take over. Let me speak to your psychiatrist. I've never heard of that medication. I was reading about it online. Please ask questions, right? But again, let the person who's dealing with the mental illness, let them be in charge of their own health treatment plan and healthcare. Because when we try to take over, that actually stifles their ability to thrive. Right? If you give them the responsibility for taking care of themselves, that actually increases the likelihood that they'll be successful in taking care of their own lives. So it's not healthy for you to get overly involved. It doesn't help them for you to do everything. It cripples them. So instead of driving them to every single appointment, show them how to get there, give them a map, show them how to order an Uber. Or if they can't do that, give them help them get like an MTA card, a bus card, a train card, something, like help them figure out how to get there. Instead of coming and cooking for them every single night, you can bring them dinner sometimes, but show them how to make easy meals. Like, let them learn how to take care of themselves. Instead of doing their laundry for them, come over and help them do their laundry and give them that independence. Like, don't take that away from them. That's important. And remember that they still have a voice. I see a lot of the time that sometimes I'll have people who have mental illness and their family comes into session and like they don't let them speak. They're going to tell me what's going on with the client. And I'm like, she's right here. Like, let her tell me what's up, right? If you take away their voice, that makes them feel helpless. That makes them feel ashamed. It makes them feel like they're like useless. It gives them like this really bad sense of self. So let them talk. Ask them. Have open and honest communication. What's going on? How can I help? Do you want me to come to the appointment? What do you want me to tell your therapist when I'm there? We want to let them know that we believe that they can take care of themselves, that they're not like a baby, they're adults, or even a teenager, right? Whoever it is, we believe that they have the ability to take care of themselves and that they're capable, they're confident. Treating them like they're like some, lunatic, it's so harmful to them, and that can send them just in a downward spiral. So that respect is very important. Remembering that you are not a fixer, you're not a savior, your love cannot save them. So it can't be like, but I love you so much and I'm here for you all the time, why aren't you better? That's not what it's about. That's not how mental illness works. So you can love them from here to the end of time, and you can do their laundry and drive them to all the appointments, but at the end of the day, it's up to the person with the mental illness how they manage their care. So you just need to be a loving, stable, non-judgmental, supportive person in their lives. That's going to be your rule. And the way that you're going to be able to do that is, again, by engaging in that self-care that I sort of mentioned before, and now I want to get into more. You have to preserve your relationships with your friends, with your other family members, with your community. Don't fall off the face of the earth because you have a family member with mental illness. You have to, it's hard. You're going to find yourself focusing only on that person, but you have to be focusing on the other people in your lives that need you, or that you need, that you like to be around. If it's another child in your family, then their siblings might feel angry or frustrated or resentful or sad or scared. You have to deal with those siblings. You have to deal with your other kids. You have to set aside time to be with them, communicate with them, ask them how they're feeling, talk to them, get them help if they need it. That's important. You can't just forget about yourself and everyone else because you're so focused on this one family member. Remember that like most people with mental illness will improve over time. And it's so important that if it's, let's say, your spouse, your attitude about your partner with mental illness and your behavior makes a very important contribution to their recovery. So if you're negative and you're like judgmental and you're not supportive, that could push them into a darker place. So you need to make sure that you're being a supportive and helpful partner, and that you're saying, like, do you want me to come to therapy with you? Do you want me to go pick up your medications? Do you want me to take the kids? You look stressed. Let's get your mom to watch the kids and we'll go out for dinner. Do you need to take the day off of work? Sometimes it happens that your partner is so incapacitated that they can't work. You guys need to figure out a plan together instead of being angry and resentful. This is not what I signed up for. You were normal when we got married. You have to decide if you're going to fight against the diagnosis or if you're going to fight with them against the diagnosis, and not against it in the way that you're not accepting it, but in the way that you're going to help your partner find themselves again, that you're going to stick by them and say, like, I know we can get through this together. So it's really about your attitude, and that plays a big role. Again, I'm not trying to blame, but it plays a big role in the success of their recovery is your support and your attitude about it. And like, you might be like smiling at them and being like, I love you and I hope you get better. And underneath you're like, what is my life? Like, I can't, I'm so angry about this. So you need to go for therapy yourself if that's happening. You should anyway. You should go to therapy yourself, and you should go to a support group for, families who have spouses with mental illness or children with mental illness. And you can find a group in your area. The National Alliance on Mental Illness, NAMI, they have a website where you can like Google groups in your area or therapists that deal with that. But a support group I think would be amazing. So if you can find that, do it. I'm sure OHEL has, I don't know off the top of my head if they do specifically for spouses with mental illness. They might. I can find out and let you guys know, and you can put that out there. But definitely a support group is so important. And again, family members and caregivers play a huge role. They are vital to recovery. So you need to be at your best. You need to be taking care of yourself. You need to be able to be supportive. So you have to okay. Rafua, great. That's good to know. So yeah, there's so many organizations out there that I'm sure are helpful, and you can look it up online, and I'm sure you could Google support group, family members, mental illness, like find something. It's really important also to resist the urge to say, like, try harder, right? You're not trying hard enough. You're not going to your therapy appointment. Your medication isn't, you don't take it all the time when you're supposed to. You don't tell someone with asthma to try breathing harder, right? Like they can't control it. So it's the same thing with mental illness. Sometimes we think, like, with matters of the brain, that it's just like a matter of grit. Like, you just need to try harder and then you won't be, bipolar, or you won't be schizophrenic, or you won't be depressed. That's not how it works. It is a brain disorder. It is an illness. You can't will away the flu. You can't will away cancer, right? It's the same thing. We do whatever is necessary to treat the symptoms and to manage the illness. So don't say try harder. You're not trying hard enough. You didn't do what you were supposed to do. That's not how it works. If you see that they're having a bad day, be supportive. What can I do? I see, like, you didn't want to take your medication today. What's up? Should I schedule a therapy appointment for you? Do you want to do it? Be compassionate, because the more also they feel like you're nudging them and you're nagging them, the more they're going to pull away from you. And that isolation is very dangerous for a person with mental illness. They need to be supported and feel like if they are having a bad day, that they can reach out and be like, I don't want to take my medication today and I'm in such a bad place. At least there's that opening then that you could say, okay, let's talk about this. But if you put yourself in a position where they never want to say that to you because they're scared you're going to judge them, then they're worse off for it. So it might be hard for you to hear that they say, I don't want to take my meds. I hate how I feel. I hate my therapist. But instead of freaking out and be like, oh, but you need to see her. And then okay, I get it. Fine. Maybe we can find someone else. Do you want me to help you look someone up? You know what? My friend just told me that she knows this awesome therapist. It's her friend, or whatever it is. I'm going to help you, right? Don't take symptoms personally. This is really, really hard. And this is something that I hear, oh, someone's putting the link for Rafua mental health referrals. That's great. I hear this a lot. People are taking symptoms personally. So if you have someone with mental illness who is depressed, let's say, right? And not like depressed like my dog died, or like, oh, I'm so depressed, my favorite shoes are not available online anymore. I mean, real depression, right? Sometimes it's hard when they get in that like mood. It's hard not to take it personally. Like, but you're with me all of, we just spent like a whole nice weekend together. Why are you in a bad mood? Like, what did I do? You weren't happy being with me? Again, it's not about you. It's not controllable. It's as uncontrollable as throwing up during the flu. I'm not throwing up because I think you're repulsive. I'm throwing up because I have the flu, right? So if we kind of view it that way, like if you think every time your kid has a virus and they're vomiting, it's because they're sick and right? You're in for a lot of disappointment, right? Like your kid is throwing up because they're sick. So same thing, if those symptoms are coming up, and again, that's why you need to be educated about what the symptoms are. If those symptoms are coming up and okay, this is part of it. Like, I get it. This is not about me. I see things are happening. It's not a choice, right? Then you're going to be able to kind of let it go and be kind of more in like the supportive role instead of the like, oh, like it's never going to get better and I'm not doing my part and she's upset with me or he's upset with me. It's not about you. And those symptoms are not personal. It's not about anything you did or didn't do. Remember that you have to also let go of a timetable, right? There's no shoulds. Everyone's journey is their own. So even if you know someone who has a sister who had, whatever it is, mental illness of any sort, don't say, well, okay, but she had her stuff under control 3 months in. Like, why aren't you? Like, aren't you supposed to also? Everyone's journey is different. Everyone catches it at a different point. Just like, again, that kind of analogy of like cancer. Like, no cancer is the same. There's people don't recover at the same rate. It depends when you catch it, how aggressive it is, how their body's responding to it, what kind of medications they're getting, there's no should, there's no timeline, this is exactly how long it takes till you're like normal again, right? It doesn't work that way. So I think if you have a family member who is in denial and refusing help, you have to remember they're allowed to refuse help. If they're an adult, for sure they're allowed to refuse help. If they're a teenager, there's more you can do, obviously, because you are the parent. So you can mandate treatment. You can make sure that your child gets the help they need. But if it's an adult, they're allowed to refuse it. You can discuss with them about how treatment could be effective and how it will impact your relationship if they don't get help, right? You can say, like, I'm not going to answer the phone when you call me 6,000 times at 11:30 at night. You know, I need you to get help. I'm worried about you. I'm not going to be able to come over to your house at 3 o'clock in the morning when you're obsessively texting me. So if you want me to be in your life, I need you to get help, right? Sometimes, again, if it's totally out of control, like you could get a court order if they're, you know, if they have a history of being non-compliant with treatment or whatever. These are more severe issues, obviously, but, you know, there's things you can do legally to get them help, but that would have to be that they're seriously, really either in a psychotic state or a danger to themselves. Acknowledge why they might be refusing even. So maybe if they accept that there's something wrong, they feel like a failure. Maybe they're scared of the financial impact it's going to make. I'm not going to be able to have my job. I'm not going to be able to go to school. How am I going to afford therapy? They might have serious concerns. What if people find out? You know, maybe they think that it's not going to work. Like, yeah, I know I need help, but like, I know so many people that went to therapy and they're not okay. Maybe they're scared of what therapy will bring up if they do get help. Maybe they're scared of what it's like to be on medication. Address these things, like talk about it with them. They might be afraid of the stigma, right? And that's something I'm going to talk about. Maybe they're terrified of the stigma. People are not going to take me seriously. They're not going to listen to me. Let's say I'm a therapist with mental illness and I come out and I talk about it. Are people going to want to come to me? It's going to ruin my business. Maybe they're thinking about that stuff, you know? Information's powerful. So if you come equipped already that you kind of know what they might be scared of, you can come and talk to them about it. Okay, I get it. These are your concerns. I'm going to help you. I'm going to support you. We can keep it private. We can deal with it this way. Find out why don't you want to get help. Don't just assume, you know, there's something like, you know, they're just trying to make your life difficult. There might be a valid fear behind why they don't want to get help. And we have to be sensitive to that and be willing to work with them. And again, remembering it's not on your timeline. It has to be when they're ready. You cannot force someone to get help. So as a community, what can we do? And I guess I want to like finish with this. This is the most important thing. I think that as a community, if we eliminate stigma, if we talk more about this stuff, if we are more open about it, if we are less judgmental, people will feel less shame in getting help. We can literally save people's lives, right? We can minimize the damage because people won't be afraid to be supportive of their child with mental illness. They won't be afraid to get their husband the help they need because they know that the community is supportive and helpful and has the resources and understands this is not something like you can choose to have. This is not something that's because of a failing on your part. Just like I don't choose to have cancer, the flu, a cold, arthritis. We don't choose to have mental illness. So if we can understand that and we can be more open and supportive and understanding and have discussion and take away these like creepy ideas we have about how mental illness is like a defect in a person, then I think people will be more willing to get the help that they need and they'll be less afraid of losing everything and feeling like a leper in the community. There's a book that I wanted actually to suggest for anyone who has a family member who maybe is in denial or doesn't want to get help. It's called I Am Not Sick, I Don't Need Help by Dr. Xavier Amador. And he gives like practical suggestions about how to help someone with mental illness who doesn't believe that they're sick. And he says that that lack of insight is actually a symptom. It's like a neurological defect. It's not a willingly like deciding, oh, I'm not sick. But that's part of the mental illness. And he gives like a communication strategy called LEAP, which is like listen, empathize, agree, and partner. And in the book, he talks about what those are, but it's basically like listen to their concerns, empathize with them, agree that like what they're feeling is real and that, you know, you understand their feelings and partner with them to get them the help they need. But I Am Not Sick, I Don't Need Help. It's a great book. I think it's on Amazon. I'm pretty sure it is. But that's kind of like the recommended book for people who have family members that have mental illness that are in denial. So he gives
Hopefully we'll share it. What's the author's name again?
Xavier, Xavier, Amador, Amador, Dr. Xavier Amador.
Okay, thanks.
I'll send you it. I'll send you the title. So he talks about that. So that's also just a great thing to have. Like, get armed with that. Read that book before you talk to your family member, and then like what to expect, and the right approach to take with them. So I think that's really, as a community, I think things like Project Proactive and talking about these things and having, I love that on Instagram, there's so much mental health talk available. Like, we are learning about how to have relationships and what mental illness is. And we're learning about, self-acceptance and just being more open about the problems that are in our community. We're learning about parenting. We're learning, like, this affects the Jewish community. This is not this is not like a secular world thing. This is an everyone thing. And the more we talk about it and the more we are open to learning about it and taking away stigmas and negativity and judgment, the more we're able to, again, literally save a life. Like, there are people that felt like they could not get help, they couldn't tell, and then committed suicide. There was so much shame, isolation. People, you have mental illness? I'm not dealing with that. I don't even know what to do. I'm not dealing with it. So we have to say, like, you have mental illness? I'm here. What can I do? What's going on? What are the symptoms? Let's go speak to a psychiatrist. Let's get information about it. We can deal with this. We can overcome it. This is not who you are. This is just an illness. I'm not flu. I'm Rachel with the flu. Right? Like, just as ridiculous as it is to say, like, that you are the illness that you are experiencing, like, it's just something that is occurring within your body that you need to learn to treat and manage. And again, even a chronic illness, right? So a cold doesn't last forever, but a chronic illness could. So if you have MS, like, we're not just forgetting that you're a human being with MS. You're managing your symptoms so that you can live a full life. And we don't judge people with MS. We're not like, "Hey, what did you do to get that? Like, you must have really, like, not taken care of yourself." So again, same thing. We have to understand that it's a brain disorder. It's an illness. And if we do that, then we'll be more accepting and more compassionate. So we just have to keep the conversation going. And again, watch that first talk that we did about mental illness and mental health. Like, ingrain it in your brain, drill it in, really accept it, do that research. And then hopefully, we'll be able to be more supportive. We'll be able to get, the help for our family members that they need. We'll be able to stop personalizing it and seeing it as a failure in us. And we'll be able to, help our family members get back to who they are in a loving way. Can you speak about the correlation between trauma history and mental illness? Not sure if you touched on it. I haven't been here the whole time. I didn't talk about trauma history and mental illness, but I'm going to leave that to you, Brachi, because that's really what you do. I'm not a trauma therapist. But maybe that's something Project Proactive could also do.
Well, Brachi is talking tonight later, so we can touch on it.
So Brachi, I feel like you should talk about that a lot, because I don't really have experience with that, and that's not my area at all. But
I think we do have trauma coming up.
Okay, right. Oh, maybe with Esther. Sure. Esther Goldstein.
We have her speaking, yeah.
Okay.
Yeah, definitely. I don't know the date, but yeah, coming up.
But just awareness, sensitivity, educate yourself. Remember that it's not you. Don't take it all on yourself. That's not your job. And again, you're harming your family member more by taking away their ability to care for themselves. They do better when they're able to get to their appointments by themselves, call the therapist themselves, cook their own meals, handle their kids. Like, don't become like a crutch that you kind of like when we like lay around for a long time, like our muscles kind of like get weak, they atrophy, because we're just like being lazy blobs. Like, if you do that, you kind of like take away that strength from them. Like, you're weakening their mental muscles by like doing everything for them. So give them
it is hard to know that line of what they need versus what's extra.
So that's why you should always ask, would it be helpful if I come over today and help with the kids? Or if you see that the house is really falling apart, you could just say, I'm going to come today, I'll take care of the kids. But have them do something else while you're there, so that they're not just sitting around like so why don't you get dinner ready? I'll play with the kids, or I'll help get the kids off to school. You pack the lunches, whatever it is that they need. Like, that's what you do. But again, being mindful that you're not like stepping on their toes and making them feel incapable. Oh, my mother thinks I'm a lost cause. She thinks I'm like this, like, you know, mindless loser. Like, we don't want to send that message. And you could even say, like, do you feel like I'm being helpful? Does it help when I come? You know? Also, remember, some days they might push you away. I don't want you to come over. I don't need you here. And again, that goes back to not taking it personally. Okay, you know, like, I'm going to respect your space. It's hard for me to hear that, but I'm going to respect your space. And not holding a grudge so that later, maybe in the week when they say, Ma, can you come over? You're not like, "Ah, well, you didn't need me on now you need me? Well, I'm busy, right? We don't do that. Unconditional. It is not their fault. Maybe it was a bad day. You have to be there unconditionally. Again, with boundaries, they can't abuse you and be cruel, you know, and you can say, like, I would love to help you, but you need to, when I come over, like, you're barking at me the whole time. Please, can we work on this? Boundaried and with respect, but also not being conditional and not taking it personally and not making it about you. It's about being supportive to them. And again, remembering that you cannot pour from an empty cup. You cannot give them what you are not giving yourself. So taking care of yourself, regulating your emotions, and doing what you need to do. Support group, therapy, whatever it is. You're not alone. Talk to other families that are dealing with this too. That's important. Okay?
Yeah, great.
Right.
It looks like do we have time for one or two questions? I don't think
Okay.
anybody. Okay, well, I don't think anybody asked while you were talking, except there was someone who shared the refuah, and which
Yeah.
we saw, and okay, yeah, I don't see anything that we missed. So then this is good timing.
Yes. Perfect.
Yeah.
Okay.
Okay. Well,
I'll send
thank you
you
so
the
much.
title of that book also, though, so that you can share.
Perfect. Yeah, we'll spread that.
Okay.
Okay. Thank you so much for joining. Thank you, everybody, for watching.
Thank you.
And yeah, we'll see you next time.
Bye.
Bye.